Good afternoon. Welcome to the Wisconsin Collaborative for Healthcare Quality's COVID-19 webinar for Wisconsin dentists. My name is Gabrielle Rude, and I am the incoming president and CEO of WCHQ. If you don't know, WCHQ is a performance measurement and quality improvement organization with values including inclusiveness and transparency, which are even more important today. And that's why we are offering this webinar to the dental community at large. And at last count, we had nearly 700 registrants for today's event. So thank you for joining. We are happy to have partnered with the Wisconsin Dental Association on developing this program and bringing this information to dentists across Wisconsin, and wanted to give a thank you to Tom Raymond and Mark Paget for your collaboration. As you may know, we have 2 speakers planned for today, but things are moving quickly, so we may rearrange our plans and start in a different order, but we will have plenty of time for questions. So at this time, I'd like to introduce Jen Koberstein, WCHQ's Oral Health Program Manager. She'll provide some meeting logistics and introduce our speakers. Jen?
Hello, everyone. Welcome to the webinar. We're glad that you could join us today. I would like to extend gratitude first to Dr. Dunkel for his effort in putting this webinar together. He went to great lengths to put this webinar together in order to bring information to Wisconsin dentists regarding the status of what's happening in Wisconsin with COVID-19. We had intended for Dr. Tiska to be our first speaker, but I don't believe he is yet on the call. So we're going to start the call with, or the webinar with Dr. Dunkel. I'm going to introduce both of them right now and talk a little bit about how to do questions and answers. Dr. Tiska provides a unique perspective for us today as the Chief Medical Officer for the Wisconsin Division of Medicaid Services, and he's also an emergency department and urgent care physician. He also serves as faculty for the University of Wisconsin School of Medicine and Public Health. Dr. Tiska may have to leave the webinar a little bit early, so after he speaks, we're going to present the questions to him for a question and answer session. Please use the question and answer function so that no questions get lost. It looks like somebody is having trouble hearing, but only one person. So I'm guessing that it is on. So if you are having trouble hearing, I'm guessing there's something happening on your end because we've only got. Oh, and that person can hear us now. Good. If you have any issues that come up, you can ask questions in the chat function, or you can send an email directly to Jared, who is managing the webinar for WCHQ. And thank you, Jared. His email address is jnishida@wchq.org. And I'm going to put that in the chat area. Dr. Dunkel is also presenting today. Dr. Dunkel comes to us with many years experience in public health, private practice, and dental education. As one of the top public health dental professionals, he has a pulse on what's happening during this crisis on a state level. Oh, and it looks like Dr. Tiska has joined us, so he will begin presenting first. Good morning, good afternoon, Dr. Tiska. Dr. Dunkel will also facilitate a question and answer session after his presentation. So we're going to start with Dr. Tiska since he is on and we know that he does have limited time. And then Dr. Dunkel will follow up with his presentation after Dr. Tiska. Welcome, both of you. Thank you so much.
Thank you. I'm so late. It wouldn't be a Zoom meeting or a WebEx meeting if there wasn't some difficulty connecting. And I did experience that, but I made it in the nick of time. So thank you for your patience.
Absolutely.
I am the Chief Medical Officer for Medicaid, and as a physician in the Department of Health Services, I have been enlisted to work at the State Emergency Operations Center for the past 4 weeks. And so that's my connection to the COVID response. I'm still more focused on Medicaid than I am on epidemiology, but I can give you my perspective. I'm sure that the reason why so many people have joined us on this webinar is because we are all desperate to know more about COVID-19. There's so little that we do know beyond the epidemiology of the spread of the disease. We absolutely need to know more about the COVID-19 virus. And in time, I'm sure we will. But just to set your expectations today, I don't think I'm going to know any more than any of you about this virus. That's because nobody really knows. It is important to remember that the CDC guidance on COVID-19 infection prevention and control is based not on what is known about COVID-19, but on current understanding of the SARS-CoV-2 and related respiratory viruses. We do not yet have definitive, specific scientific understanding of COVID-19. And so understanding how the infection is transmitted and which PPE measures are needed are based on what we understand about those related viruses and not COVID-19. Here is what the CDC has to say about that. Quote, current data suggests that close range aerosol transmission by droplet and inhalation and contact, followed by self-delivery to the eyes, nose, and mouth, are likely routes of transmission. Long-range aerosol transmission, such as is seen with measles, has not been a feature of SARS-CoV-2. So again, we're not even talking about COVID-19. Potential routes of close-range transmission include splashes and sprays of infectious material onto mucous membranes and inhalation of infectious virus exhaled by an infected person. The relative contribution of each of these routes is not known for SARS-CoV-2. So again, current guidance is based on educated guesses, our best inferences, and expert opinions, but not on scientific fact. Now I'm going to refresh our memories about the state of Wisconsin's response to the crisis and efforts to flatten the curve. On March 18, educational facilities were closed in Wisconsin, and that was 4 weeks ago today. On March 25th, all non-essential services were ordered closed, and that was 3 weeks ago today. So it seems like a really long time, and it has been, and it also seems like only yesterday. And I know that time warp has been a real disorienting factor for all of us. Efforts have focused on containment and mitigation. The state's efforts have focused on containment and mitigation measures. Containment measures have included increasing testing, increasing contact tracing, and increased use of isolation and quarantine. Isolation centers in Milwaukee and Dane counties have been opened for persons with mild COVID-19 to allow them to recuperate without putting others at risk. For example, family members or other close contacts. Mitigation measures have focused on increasing social distancing through school closures, bans, and mass gatherings, and the Safer at Home order. As I said, I've been working at the State Emergency Operations Center, where efforts have been and currently are underway to address the scarcity of PPE, to plan for a surge in demand for care beyond the resources we have, to address outbreaks in long-term care facilities, and to plan for similar outbreaks in other congregate settings such as the jails, prisons, and homeless shelters. And more recently, as it appears we may have succeeded in flattening the curve, the number of newly diagnosed cases on a daily basis seems to have flattened out over the past 4 to 5 days. Discussions have shifted towards planning how to contain and how to prevent future surges and outbreaks. Now, I'll just say a few words about telehealth, since again, in my real life, I'm the Chief Medical Officer for Medicaid, where our response there to the pandemic has been to reduce administrative and financial burdens to care and to ensure that our most vulnerable members are protected during this precarious time. As most of you know, there was sweeping legislation passed last summer to allow for the provision of care via telehealth platforms. Our plan at Medicaid was to have guidance in place by the end of this year so that providers feel empowered to adopt this new method of delivering care. But the pandemic made this work much more urgent, and just in the past couple of weeks, Medicaid has issued broadly worded guidance, which presently allows for the delivery of care by phone with or without video. The guideline, simply put, is this: whatever care you can deliver via telehealth can be billed as though it were given in person. Now, I understand that dental care is very much an in-person activity, but I would be interested in hearing from you what your care, what care you think is deliverable now via telehealth, and how having telehealth may how it may transform your practice in the future. And I'll close my remarks by quoting from Jonathan Myman, one of the Division of Public Health Chief Medical Officers who I've been working with at the SEOC. In response to the question, what is the trajectory for the state of Wisconsin's societal recovery from COVID-19 pandemic? John's response was, and I'm in complete agreement, mitigation measures will need to remain in place until Wisconsin to see a steady decline in cases, adequate laboratory testing capacity, contact tracing for all cases, and the ability to isolate and quarantine all cases. COVID-19 will continue to pose a risk to citizens until we have an effective vaccine and it's widely available. Life will not be able to go completely back to normal until a vaccine is developed. It will require continual effort to contain new cases. Thank you very much for your attention. While I may not be able to provide you with many satisfactory answers, I'm afraid I will be happy to hear your questions, as the questions you pose will, I'm sure, add to our understanding of this ongoing crisis.
We do have a question already, so I'm going to pose that question to you right now, and thank you for your comments. The question is from David Gunderson. In the short term and in the long term, are there plans to develop systems and protocols, COVID testing, contact tracing, antibody testing, and vaccinations for healthcare and other frontline workers who, by the nature of their work, cannot social distance?
Yes, those discussions are happening in the State Emergency Operations Center as they're happening in the news and on the internet, and everyone is in the same place in as far as our ignorance of the virus and that and everything that goes with that, and that includes antibody testing. We all know that antibody testing has become available recently. Problem with that is, as you probably understand, we don't know what a positive antibody test means. We don't know if that means you're immune to the virus, or that that you're infectious. And it's going to take time to do the necessary studies to be able to interpret the antibody testing that's available now. Not that it's not helpful, it's just one step in the progress of our understanding of the virus. And no doubt there will be a role. How soon that role will be significant, it remains to be seen. It may be months. It certainly will be months away, and many months, I'm afraid, my opinion.
Thank you. That's the only question we have at this time. Do others have questions? And if so, can you please pose them in the question and answer section of the webinar? We do have another question.
Quick or fast?
Quick or fast test.
There are point of care tests for the PCR for the virus that will allow people to get results within minutes of being tested. They're not widely available, but that will certainly make a difference. The testing will be most effective when we can utilize mass testing in a certain area as part of a containment effort. The problem with testing outside of containment efforts is it can give you a false sense of security if you think that you're not infectious and you don't take proper precautions, and you may have had a false negative test, or you were negative today, but tomorrow you're positive and you don't know it because you just tested yesterday. So you know these issues, but again, not that this technology isn't useful. It's just we have to be very careful as to what conclusions we come to as a result, with their results.
Okay, and next question. There's actually a question that's up in the chat section. And the question is, what is the state's role or strategy to reopen Wisconsin?
It's in development. That's all I can tell you.
Okay.
It's, I think I don't want to give you too much information about how the sausage is made, but let me just say that there are way too many problems for the number of people that are trying to solve them, and we are working to put out the biggest fires first. And as I said, the discussions at the state have shifted towards more long-term planning. The last 4 weeks have been really about dealing with the biggest problems that were immediately before us.
Excellent. The next question I think might be more appropriate for Dr. Dunkel, and maybe, oh, wait, no, hold on, there are a couple more that have come in. Hold on.
I like the question about how is Germany keeping their dental offices open?
Yeah.
I definitely, do we know if Germany is keeping their dental offices open? It sounds like Jessica thinks that they are. Yes, they are. Okay. Well, I'm happy to look into that. I'm very curious myself. Actually, I have a friend who lives in Berlin. I'll ask him. He's not a dentist, though.
The next question is, hold on just a second. Do you think that dental offices will need N95 masks for future short or long-term dental encounters?
Absolutely, I do. I think that's the only way that the dentists are going to be able to get back to work, is to have access to the proper PPE. And it's such a high risk activity doing dental work that I just don't see how that's gonna we're going to be able to do it without N95s. I would bet most dentists agree with that. I doubt any dentists are thinking they could do procedures with a surgical mask.
Thank you. And if you, after you talk to your friend in Berlin, would send that information to us, I will make sure that it goes to this group. There is a question that is simply reinfections and mutations, and I don't know what that means.
Well, I mean, they were alluding to the fact that we still don't know that you can't get COVID-19 again once you've had it, in the same way that you can certainly get influenza every year it comes around. And we also know that the influenza vaccine is not 100% protective. So when we're lucky enough to get that vaccine, we probably can't expect it to be 100% effective. So this is going to be an ongoing problem for that reason.
The next question is thoughts on mandatory air filtration in operatories, dental operatories.
So I'd like to hear is there consensus in the dental community about the need for that? I would think everyone would want that. Whether or not it's practical for many offices to have that is another question. But would most dentists prefer to see that left up to the individual practices, or would they welcome a state guidance on that?
I think we will hear more about that potentially when Dr. Dunkel starts speaking. Let's see. Able to reasonably test our staff is one of the questions. And
yeah, I think testing is going to be more available because so many people are developing tests, and they're different companies are coming out with them. So I think we'll see better accessibility. And even though tests don't give you 100% knowledge about whether or not you're infectious or not, they're certainly better than nothing. And so in the case, one of the first outbreaks in the nursing home of COVID-19 was in Sheboygan, and we debated whether or not to do testing there. Ideally, you would have the staff treat everyone like they were infected, and the staff would wear total PPE all the time, but they simply did not have the enough PPE to do that. So since some of their patients were segregated to a wing if they were positive, we thought it'd be beneficial to test everybody so that the ones that weren't diagnosed yet could be moved there. And so we tested all the staff voluntarily, all the staff who volunteered to be tested, and all the residents. And there were an additional 5 residents that had not been diagnosed, and additional seven staff that were positive and didn't know it and were working there. So my point is, asymptomatic COVID positive workers do pose a danger to their co-workers and their patients. And even though false negative is still dangerous, if we can find out people are positive, it's very useful.
Thank you for that. One of the questions that came outside of the chat box was, are we still looking at May 1st as a starting date for dental practices? And if so, what procedures can or can't be done?
Russ would know that. That's a good question, Russ. What do you think? Oh, you're muted.
Can you hear me now, Steve?
Yep.
Okay. Yeah, and in the recommendations that I put out, what I had put in there was basically until the pandemic is over or it reduces dramatically. So I didn't put a date in there. I know the governor has April 24th marked, and like you said, it's being evaluated and looked at, you know, where they're at with that, et cetera. So, and the other factor, and I'll address it a little later on, is what's going to be the availability of PPE for people once the startups start, you know, when people start working in the practice again. So that's something I'll work on, I'll talk about in a little bit later, but yeah, it's an issue.
Well, there's a question from Linda Jorgensen about cleaning and sterilizing N95 masks, and I've seen a number of procedures that have been demonstrated to be effective. Some are easier to do than others, but I do think that's going to be a key part of our strategy for making more N95s available is instituting some sort of reuse policies that will expand the life of those. We're already doing it. I'm sure you're doing it in your offices. When I'm working in the ER, I have my N95 in a bag, and I use it and I cover it with a surgical mask. And those kinds of preservation strategies are definitely going to be a key to making sure we have enough to go around.
Yeah, I would agree.
I think there's a question here that's definitely specifically for you that says, are you hopeful about the hydroxychloroquine, azithromycin potential treatment?
I looked at the initial French study that was done, and it's just a terrible study, really worthless. Everyone who was in the study who ended up on a ventilator was excluded from the study, for example. So I think that's where the skepticism comes from, is that it's being proposed without any serious evidence as a potential treatment. Not that it shouldn't be studied, and I'm sure that it is being studied right now. We just need better studies to tell us if it's worthwhile. If it was me and I was sick, I wouldn't take it. I just find in our experience with viruses, and we've got a lot of experience as a species. We don't have good drugs for viruses. It'd be really a miracle if a couple of antibiotics that we have sitting around happen to be useful against this pandemic. Not that it's not worth looking at, and it, like I said, it will be scientifically studied.
Okay, we have a lot of questions, so I'm going to keep going. Could non-aerosol procedures be done without N95 masks?
I think they could be done. I wouldn't recommend that that they are done until we know more about the virus, because we just don't know what that risk is. And certainly the risk is not zero. If you were to institute a practice of doing non-aerosolized procedures with a surgical mask, there is going to be some risk there. We just can't quantify what that risk is.
Thank you. There are a lot of questions, you guys, so I'm trying to make sure that I get all of them. Dentists have a long tradition of good prevention of communicable diseases. Are you saying that what we are doing right now is not sufficient?
No, not at all. Doing what right now is not sufficient. I think everybody's doing, good practice, universal precautions. That's all you can do right now. And I think the reason why dentists have been asked to curtail their activities is not only to reduce the workforce risk, but also to reduce the risk of people who are sitting in the waiting room. So, whether that's the best strategy or not is debatable, but I think, it's the current stay-at-home order is not going to last forever. The question is, how long is it going to last, and how long do we get out of it? And nobody knows the answer to that. But I mean, tell me if I'm missing something. If I insinuated in any way that dentists haven't been doing what they should have been doing, that I don't feel that way at all.
Okay.
I'd support Steve on that. It's not that we're saying that dentists haven't been doing things. It's just now the landscape, unfortunately, is changing. This is changing seriously how we need to look at stuff. Doesn't mean what we were doing wasn't ideal and very good practice. This unfortunately may change things a little bit. Does that kind of help too, Steve, do you think?
Yeah, that's right. I mean, this is not influenza. This is several times deadlier than influenza, and it seems to spread very easily, and that's why it's a different game. It's not. It has a bigger impact, and I think overall the response has been good to the measures we've taken, and we're seeing that the curve is flattening. So I think that's very encouraging.
The next question is, what initial testing should be done on patients that do need care? In other words, taking temperature. So an emergency patient presents, how should they screen them?
So if someone has respiratory symptoms and a fever, they should be treated presumptively as if they have COVID-19, and they should be put in a negative pressure room, and any staff that go in that room should wear complete PPE. In terms of testing, some offices are testing everyone if they're suspicious for COVID-19. They're also testing for, besides COVID-19, they're testing for influenza. And it's very rare that someone is positive for both influenza and COVID-19. It's something like 5% of people who are positive for COVID-19 are positive for influenza. So some places are using influenza as a screening strategy. If they're positive for influenza, they're stopping there and calling it influenza and not testing for COVID-19. That's more in areas where testing isn't as widely available. Otherwise, it's if someone is if they're not too sick, they're well enough to go home, and they've been tested for COVID-19, they are instructed to keep themselves under quarantine until the results are back, to social distance as much as possible in the home, and to come back if they get any worse.
The next question is, if you have an emergency patient that may require creating an aerosol, how would the patient be screened for COVID within the dental office, and what PPE would you recommend?
I doubt if any dental offices have the swabs for COVID-19. Am I right about that?
Probably not.
Yeah, I'm not aware of any, Steve.
So
We've only gotten maybe 2 shipments in the warehouse I've seen so far. So
I would say though that if I'm going to go out on a limb here, and if you're in the office doing an emergency procedure and someone has a fever and respiratory symptoms or had close contact and you're concerned for your safety and the safety of the people in your office, I think referring them for testing is definitely appropriate, and calling probably a local urgent care and arranging to have that testing done would be the best way to go, as opposed to sending them to the ER where the waits are longer. And as an urgent care doctor, I think an urgent care would be the most appropriate place to have the person tested. What PPE would I recommend? I would recommend, I mean, if you're going to do anything with that's aerosolized, I would recommend full PPE. Are people practicing? Are you talking about? No, okay, sorry. Are people practicing? Are people doing procedures without full PPE, feeling like they need full PPE, but they don't have it and they're doing it anyway? Is that commonplace?
yeah, and I'm not sure that it is, Steve. Maybe some of the people on the call can respond to that. I'm hearing some that offices are open and they're using just a mask and they're using it for a whole day without a face shield, et cetera. That's a serious concern, you know, and it's not an N95, obviously, because very few offices have N95s. It may be a level 2 or level 3 surgical mask or procedural mask at best. Are you getting anything, Jen, from the chat box at all?
You're muted, I think, Jen.
You're muted, Jen.
Having trouble. Oh, there we go. I know, Dr. Tiska, that you had some time constraints. Are you still available for some more questions, or you're okay?
For the
Okay.
duration.
One of the questions that just came up was dentists don't know what full PPE means. Can you please explain that?
N95 or a PAPR. PAPR has a face shield, so N95 and a face shield or a PAPR. A surgical gown and gloves. That's it.
And I just did get a comment from a panelist saying, yes, we are doing emergency procedures with level 3 masks only.
And a face shield, I hope. But okay, so that is something that needs to be addressed then. Are these emergency procedures mostly office-based? I imagine probably in these situations they are. If you're in a hospital, you probably have better access to PPE. So here's what I would recommend. The best way to get PPE is to make a request to the State Emergency Operations Center through the Wisconsin Emergency Management System. Every county has an emergency manager, and you can just Google emergency manager for your county, and then through that manager you can put in a request for PPE and explain why it's needed. And I have pretty good confidence that you'll be able to get something from the state's stockpile. And please reach out to me if you make that request and you're not successful. I think this is really important that you're supported in your work, and if that's not forthcoming, we need to work on that. So hopefully that was clear.
I just got a request that you repeat the information on who to contact for PPE.
Go through, so contact your county emergency manager. That's Wisconsin has a Wisconsin Emergency Management System, and every county has a manager. And that if you submit a request through that manager to the state for PPE, there is a supply there. It's being allocated by tiers, long-term care facilities at the top and down from there. But there's a very compelling case to be made for dentists who are doing emergency procedures. They must have this equipment.
Excellent. Dr. Dunkel, do you want to speak a bit and then the two of you can continue to answer questions together? Does that make sense at this point, or do
Do that. Is that okay with you, Steve? How you're doing time-wise?
I've kind of monopolized the discussion.
Okay, that's fine. That's fine. I wanted you to go first because I didn't know what your time constraint. And Steve is right. I was going to bring that up later about the, the SEOC, but then also the emergency managers in each county. That's the place that private offices or smaller group offices, et cetera, can reach out to within their county. That's the best place to get on a list for supplies. And I would, especially when you're emailing or making the request, make sure that you identify the fact that you are doing emergency procedures. I mean, if you're doing one a month, you may not get much, but if you're doing one a day or 10 a week, you definitely qualify for needing those procedures and those supplies. So definitely, contact that group. Anything to add on that, Steve, or?
No, that's it. And we need that feedback loop. If you make that request and you get nowhere, I'll give you my email, and I want to hear from you. Actually, I'll give you Russ's email. No, just kidding.
Hopefully you got that one.
Steve.Tyska, Tyska, at dhs.wisconsin.gov.
Thank you. Dr. Dunkel, is there anything else that you want to address right away, or do you want us to continue to do questions?
I can just do some opening remarks, and then we can kind of fall back on the questions as long as Steve's got some availability. I just want him to be, particularly cognizant of his time and respective of that. So I wasn't sure what he'd be drawn into either. So we're all being pulled in different directions. So I get it. Am I coming through okay? Can everyone hear me all right?
Perfect.
Great. All right. For one thing, I just want to say I want to thank the WDA, WCHQ for putting this together, along with, I want to really thank my good friend and colleague, Steve Tyska, for agreeing to participate in this. But I especially want to thank the 700 plus participants that are on this call or webinar. It really goes to the fact that we're all struggling, and we're going to try to do what we can to get through this. And I don't think any of us back in January 1st would have thought that, watch or catchphrases that were things like divergence or outsourcing or thinking out of the box or paradigm shift or outsourcing would have been replaced with things such as, fluid situation, unprecedented, social distancing, flattening the curve. And especially the fact I'm amazed that worldwide, everybody now knows what the acronym PPE stands for. I don't think you can talk to anybody now in the country or the world that doesn't know what PPE means. I want to start out too with a couple disclaimers as well that Steve's kind of alluded to, that there are going to be questions that we get to that we're going to just thoroughly not going to be able to give you an honest answer because we really don't know. There's so much about COVID we're still learning. It's ongoing, and even things when we talked about, the stay-at-home order, we don't know where that's going to go from here. They're, like Steve mentioned, they're looking at it, but we don't know what the response is going to be or what the answers are going forward in that. And also going forward, I'm not giving any legal advice, and I'm definitely not an attorney, and I'm not the governor or the state secretary. So I want everybody to take what I'm saying as that I'm providing more information. We're looking at issues, and that we're just trying to come up with, some alternatives or some scenarios to try to help you consider what to do next. And that being said, I do understand that there's a tremendous amount of attention and that there's, emotional stress and tension going forward. I completely understand that. There's a lot of fear, anger, frustration, uncertainty, and just a concern of what the heck do I do next? I get that. And, I can speak to, for those of you who don't know me very well, I was a wet finger dentist and in clinical practice for 38 years. So I understand what it's like to keep an office running or trying to keep an office running. And I am definitely sincere when I'm saying I fully understand your concerns and what you're going through. I get that. And I am definitely sympathetic of it. And I don't know that I would feel any different than a lot of you are about being angry and concerned and just fearful. What am I doing next in my practice? I get that. Now, some of the questions that we're going over that we brought up a little bit, Steve started talking and we've been asking about the safer at home order. Like I'd mentioned previously in the directive that we kind of put on the DHS website, what I listed under, strongly recommended was that this order would stay in effect, or this recommendation would stay in effect until after the public health emergency is passed, rather than giving it a date, simply because we don't know what's going to happen. Steve mentioned, and John Lyman had also said that, yeah, we are seeing some flattening of the curve. We're hoping that's the trend, but we still don't know. And we still don't know how many people that, should be tested aren't being tested. That's the other concern we don't know is, are there an ample number of people that are being tested? And Steve had also mentioned too that there's two significant types of tests out there. There's the nucleic acid test, which is a little more accurate, which is basically an RNA test. And that's what he was talking about, the PCR. And the other one is the serology test or the antibody test. With that, again, not only going to the facts that Dr. Tiska mentioned, but also the fact we don't know exactly when you're going to develop those antibodies. It could be 2 or 3 days, maybe even 4 days after you've been exposed to the virus that these antibodies are developing. So it still may be a false negative when indeed you are a positive for COVID. We just don't know for sure. Would you agree on that one, Steve, that I'm getting that correctly?
Yep.
Okay. And, and I know some questions I've gotten as well regarding the stay-at-home order and the dental office closure. Is there any work being done as looking at it from a county by county basis? If Steve's heard anything at the SCOC, I don't know that they're doing that. I'm not saying they are or they aren't. I just haven't heard anything about looking at it from a county by county specific that they would be able to say, okay, these counties will do the safer at home, but these counties are going to be able to do it. And there's reasons why that could happen is one of the things we have to look at is county borders aren't like international borders. It's not like there's a checkpoint you go through or anything else along those lines. Things are fluid. So people are going to be moving back and forth. So you could be in Polk County or Lincoln County or whatever. And granted, you are seeing very few cases. You certainly may not have any deaths and very limited positives. But that doesn't mean you may not be next to a county that's a hotter spot. And people are just going to be traveling back and forth between those. So if just because you have a band in one county and a different scenario in another doesn't mean you're not going to get that cross contamination going back and forth, because people are fluid, people travel. That's all there is to it. Also, another thing to bring up is, as far as I know, the governor does have the authority for 60 days to initiate a public health emergency. So the safer at home could be extended if he decides to do so, I believe, for another 30 days. Beyond that, then after 60 days, I do believe then it has to go also to the legislature. So it would be basically acted upon both by the legislature, the state legislature, and also the governor. I wanted to mention that as well. Also giving you some additional background information as far as the safer at home. 43 states in the country have issued the safer at home order. There are only 7 states out there that have basically not initiated a safer at home order from the governor's office. And along the issues as far as mandated closures. Yesterday, there was 23 states that have actually mandated or required dental office closures. This morning, Illinois just added itself to that list. So now there are 24 states that have changed from a recommendation to a requirement regarding mandated dental closures. And this is just information I want people to have so they understand what's going on from a national standpoint. And some of these states, for example, Oregon, they've issued this till June 15th. That's where their orders go. Virginia and Oregon also have stated that if dental officers are doing anything beyond emergency procedures, they will look at it as a class 1 misdemeanor and they will initiate criminal charges based on that. Other states such as Nevada and some others are looking at it as unprofessional conduct, and they are contacting the dental examining board and asking them to pursue actions along those lines as well. Again, I'm just saying that this is other things that are going on. You need to be aware of it. I think I've answered the stuff about the county. So I think, Jen, at this point in time, why don't we open it up to questions that both Steve and I can work on together for
Okay.
the group?
People are asking for more information about how to get the emergency preparedness site, and I'm not having an easy time finding that. Can you provide that for us, or do you know how people can find?
You mean the SEOC?
To request PPE. Yep.
I think you're muted, Steve.
I'd like to try to test this out, but I'd have to get off the WebEx, or maybe I can move it. Okay, I would try. Oops. Can you hear me still?
Yeah. You're good, Steve.
Okay, let me just see. I think you look up your county. So let's do Columbia County, emergency manager. Okay, and then you'll get to first thing that comes up is emergency management, Columbia County, and so they have, and then there's a little box that you click on for coronavirus, and you should be able to determine who your. There'll be a phone number where you could call, contact us, and just tell them you want to make a request to the Wisconsin Emergency Management System for PPE.
Thank you. There are a lot more questions, so I'm going to keep going through these questions, and for both of you, and both of you can chime in. So one of the questions was whether or not the state of Wisconsin has mandated that dental offices close or recommended it.
At this point in time, it's a recommendation only. It is not mandated. So Wisconsin is not one of the states that have mandated it at this point.
Okay. There are so many questions, you guys. I'm just doing my best to try to filter through them.
That's fine, John.
It doesn't look like there's going to be a CE for the seminar. There is not. We put it together so quickly that there is not a CE. Let's see. It seems like to reopen or not reopen is an economic, political, and health. Does it seem reasonable to reopen a practice in Wisconsin? It's hard to read this question. Hold on just a second. Or Dane County. That looks like the question, unless Jared can help me. Does it seem reasonable to look at reopening a practice? It looks like what the question is.
You know, there's a theme that's coming up in a lot of these questions of, you know, when to use what PPE, and I think really what it comes down to is that providers, every medical provider on the front line is. Am I still up?
Yeah,
Okay. Can you hear me still or no?
yeah, I can hear you, Steve.
Can you hear me, Jen?
Yes, I was muted. I can hear you. Thank you.
Okay, sorry. I was just going to make the point that basically every provider of care in the state is faced with the same dilemma, and that is, they're putting themselves at risk when they go into their office because they're going to be exposed, and whether or not they have the right amount of PPE, or whether or not they open their dental clinic for business, they're going to be putting themselves at some risk, and that risk, the amount of risk is unknown and unquantified, and so in the end, it's going to come down to a personal decision of whether or not you are willing to take that risk for yourself and for your employees, and then you have to think about your patients and what risk they're at. So what risk they're taking on. So those are difficult decisions that have to be made by individual providers based on the best knowledge they can have and the most scientific facts that they can attain. It's not easy.
Dr. Dunkel, maybe you can answer this question. The question is, if a patient is in pain or has loss of function, can't eat, or is having trouble chewing, is this considered an emergency?
Yes, yeah, that definitely would fall into the category of an emergency procedure. And also what Steve would mention too, the other thing we have to look at too going forward is with the PPE, the state has ordered, as well as every state in the country has ordered, significant amounts of personal protective equipment, ranging from gowns to coveralls, to face shields, to masks, N95 masks, et cetera. The thing that we're going to have to be particularly aware of and kind of cognizant of is what's going to be available even after the fact. So that's the other thing we have to look at too is, you may be able to open your offices, but maybe what you may be unfortunately have to do is maybe look more at urgent needs and that type of thing, even a little bit over the emergent needs, and maybe less on hygiene, unfortunately, just because of the availability of the equipment that you're going to have to protect yourself, your staff, and your patients may be limited. I don't know, but even when I'm working at the warehouse every day, there's a lot of, we don't know a lot of times what the ETA is, which is the estimated time of arrival of a lot of these supplies. There's literally about $60 million worth of PE equipment that Wisconsin has ordered that's still coming in. So that's what, when Steve was mentioning, and I was going to bring it up too, definitely get a hold of your emergency manager in your county and put a request in. So at least you're on the list to get those supplies. That's critical, especially if you're treating emergencies. You really need it.
There's another question that, oh, what was that?
Know whether, real
Go
quick,
ahead,
Jen, Russ, is WDA doing anything in the realm of PPE procurement?
Not that I'm aware of. I mean, I know they've got a supply built in, or supply company with, but I also know the WDA donated almost all the stock that they had from PPE from Mission of Mercy. So that was already donated to the state of Wisconsin. So I don't know if they have much of a backup. One other thing that we can add on top of what the emergency management and emergency managers in the county can do, one thing that WDA can do in response, and I've talked to Gene Ayers about it, is the WDA can write a letter and get on the list to the actual procurement at SEOC and get on the list too for possibly obtaining PPE. Everything helps. So I would definitely encourage that as well.
Yeah.
And I can reach out to Mark Paget and Tom Raymonds on that as well, who's the WDA president.
Great. The next question is, are there ramifications for clinics who still provide full scope non-emergent dental care?
Well, there could be. I mean, basically because it's a recommendation, I don't know what the legal implications would be. Again, like I said, I'm not an attorney, but my concern is, and that's why I mentioned about what some of the other states were doing. Everybody on this call knows that, you know, you've always got to be concerned about not only public health implications, but there's legal implications to protect your practice. You've got to look at those scenarios as well. If something happens in another state and it sets a legal precedent, how do we know it's not, attorneys are great at looking through, Google search or their legal search or whatever, and finding out what new precedences are being set from a legal standpoint. I just don't want anybody to get themselves in trouble or, put themselves or their team in jeopardy for that scenario. So we've got to be careful from that standpoint. The other thing I would advise people to do, again, I'm not an attorney and I don't know, nor am I an insurance specialist, but if you're doing things that were not recommended during the emergency recommendation that you are opening and doing procedures as usual, I check with your malpractice carrier to make sure that you are covered in case something happens, because there is a chance that if there's an incident, the state is trying to do contact tracing and they're amping that up to try to figure out where people are being exposed to it. Just things to be thoughtful of. Do you agree with that too, Steve?
Yeah, absolutely.
There's another question here that says, can you provide a source to the Illinois dental office closure mandate and misdemeanor classification, or in Nevada? And where was that? Where did that information come from is what people are asking.
Okay. Illinois, I just got word this morning or this afternoon that they closed. I don't have any of the details that they issued that mandate. Some of the information that I received is from the Association of State and Territorial Dental Directors. We're in contact literally on a daily basis. So one of the directors has been real good about updating that. You can go, for example, to the individual states and look that up. So Oregon would be a perfect one to just go to the state. Iowa, for example, has a mandated closure or basically a recommendation for a requirement for closures for dental offices. But what's interesting is they don't have a safer at home executive order. So, there's 7 states that don't have safer at home orders out there, 43 do, but now there's 24 states that do. The best thing is go to state. There's no real source that I'm aware of, just what I've been gathering from day to day, inferences from the STDD.
We're getting very close to 4 p.m. here. I do want to say you guys have had the most robust question and answer session that I've ever been a part of. And I'm going to ask Jared if we can copy the questions and questions that weren't answered. If I could follow up with Dr. Dunkel and maybe we can get some answers. And also it looks like some of them are directed at the WDA, but we'll do our best to answer some of those questions and figure out a format to get those to you. We did discuss that we're going to post a recording of the session on our website at WCHQ.org so that you can go back and reference any of the questions there. And then Gabrielle is going to wrap this up. I want to thank Dr. Tiska and Dr. Dunkel, myself, and then ask Gabrielle to jump in.
Well, I get one part of this. This was an amazing conversation, and we at WCHQ are happy to help in any way we can. The immense response we got today suggests our work is not done. So we want to be there for Wisconsin dentists. We again appreciate our speakers very much for you taking the time in this busy time and for answering questions. And if there is more we can do, as Jen just said, please reach out to us. We will be here to assist in any way we can. If you do have questions specific, we can pull up Jen's contact information. Jen is our oral health collaborative program manager. So she is our point person who is happy to do legwork for you. So if you have any questions, contact Jen. We're willing to help you any way we can. And again, thank you to our speakers and thank you to our participants for joining us in the webinar today. We were happy to have you and look forward to the next conversation. Thank you.
Absolutely. Thank you.
Everybody.
Thank you, everyone. Please be in touch if I can be helpful. Thank you. Thank you, Dr. Dunkel.
You're welcome. You're welcome. And people can contact me as well. Just like Dr. Stiska, you can also reach me via some have already contacted me by phone and email, so please feel free to do that. I'll help in any way I can.
Thank you.
Thank you so much, everyone. And
Have a
thank
good
you